Hi, this is Dr. Lokesh, Edara. Thank you for joining me. This is December 7th. I'm trying to update on Omicron, COVID-19 information. Let me share my screen. So as you all know, Omicron is COVID-19 variant of concern, and with high infectivity rate, with so many higher number of mutations. So first, I like to show where it started in South Africa, the case numbers. There are 4 waves in South Africa. This is the last one you see, in sharpest rise of the wave within less than 3 weeks. That's what concerned everyone. And when you look at the death reports, which is highest report around 750 in the second wave and third wave up to 500 per day. Now the reassuring thing is less than 10 or 20 cases recently, but we need to follow, we need to be cautiously optimistic next 3 weeks. If these death rates remain below 10s, that will be a good sign of relief. Let me report differently. The slide shows this is November 7th. Number of cases in South Africa is 293 as they grow, increasing to 312, and December 1st, within 2 weeks went to 8,000. Now in the third week is up to 16,000 and 6,000. Death reports actually going down or lower, and yesterday it's reported 9 cases, and November 10th is reported 48. As you all know, Delta variant is the predominant, and that caused more death reports. And next 2 weeks is the one we need to watch in South Africa. And positive rate is high because we know positive rate is high, and that's what case reports higher. The main thing we are looking at, the hospitalization is also went up. This is 3 days older report, and the Omicron rate, the red one is the Delta hospital rate, and then Beta, and this is the first wave. So vaccines, are they effective? Initial report says yes. At this time, we think 70 to 80% of hospitals are unvaccinated, reported from South Africa. Unfortunately, we're seeing more doubling the hospital admissions. So they're milder. Some reports say oxygen need for these hospital admissions are lower. Doctors say most of the patients have not been vaccinated. But some reports in the newspaper say the hospitals are overwhelmed, but it could be milder and non-oxygen needed. But we still need to wait next 3 weeks to see report. This is from Anthony Fauci 2 days ago, said that hospitals are not overwhelmed. So they may have more detailed report. So how about the vaccine rate in South Africa versus India? One dose of is 29% South Africa, but India is very ahead, 54%. And 2 doses, the recent report I saw is 24% both in South Africa and in India. So IIT Kanpur predicts that with this information, third wave likely early months up to 2022. The way if it comes to India, if there's a lot of several ifs, if the demographics, the patients volume, whether it's going to go in India, we don't know. So the main province of Gauteng in South Africa, that's where the most population. It did several news reports show the hospital admissions are higher, and this is some reports are quadrupling, and the patients are 300 3 weeks ago now to 7,000. So why this increase? And this is a spike protein of COVID-19. And if you look at the mutations, there are 18 mutations in Delta versus 43 mutations in Omicron. That's the reason infectivity rate is higher. What are the symptoms? So far we see is dry cough, fever, like a flu-like symptoms, night sweats, nausea, body pains. This is by Dr. Pillai from general practitioner in Gauteng province in South Africa. In South Africa, Omicron did replace Delta, so that's a fact. So if it is less virulent, replaces the Delta more virulent, that is a good news, and we need to watch for the next 2 weeks. So what do we do now? Wear the masks in-house, office, and schools, vaccinate 2 doses. If third dose is available, third dose is 6 months after second dose, is highly recommended. In UK also, Omicron cases are going up. Is it happened super spread event as we expect? Omicron is very spreads faster. There's a case reports in Oslo. There's a Christmas function, and then all vaccinated, tested negative before the meeting. But still, the half the people who attend have positive COVID. And in Scotland also, this is the same thing. Is it COVID vaccine effective? They do say, especially hospitalization and severity, COVID vaccine is effective. Can you have reinfection on those who are, if I have COVID infection like 6 months ago, can I get Omicron? Yes, they are showing 2 to 3 times chance you may get infected, higher than before, Delta. So treatment is same. Have most physicians know what is the current treatment. Of course, monoclonal antibodies or other treatment protocols, supplement and support like oxygen, etc. The one concern thing is the children below 5 years admit more. They're still investigating what severity, what's the reason they're in the admissions, but no deaths. There have been no COVID-related deaths among 34 admissions in pediatric COVID wards over the last 2 weeks. This is something we need to watch next 2 weeks. So the main information so far is, yes, COVID Omicron is more infectious, but death reports are lower. So if we watch next 2 weeks, death reports remain low. Hopefully in South Africa example, we learn to make more decisions, policy decisions next 2 weeks. Information we're waiting for. Thank you.